Breech. Noun. A person's buttocks. Hi, I'm Nate, and welcome to another video in which I talk about pregnancies. And today we'll be discussing breech presentations. What is breech? Breech presentation is when baby's buttocks or feet are pointing into mum's pelvis. Before 28 weeks of the pregnancy, about 25% of babies will present breech, and that number decreases to around 3 to 4% at 37 weeks of the pregnancy. And there are three types of breech. Firstly, we have extended or frank breech.
Who's Frank?
In which the baby's buttocks are presenting and the legs are stretched. And then we have flexed, otherwise known as complete breech, in which baby's buttocks are presenting and the knees are bent.
Oh.
And lastly, we have footling, when baby's feet are in mum's pelvis. About a quarter of breech are diagnosed during labour. The rest are found during the pregnancy when a midwife or obstetrician is palpating the abdomen, or when a parent is having a growth scan. The best way to diagnose breech is with an ultrasound scan. So if your care provider is suspecting breech on feeling your tummy, they may refer you for a scan. So you've had a scan which showed breech. What should we do next? The most important thing to note is that a breech presentation does not cause problems to either mum or baby during the pregnancy. However, it can influence how you wish to give birth. Let's now have a look at the options. Firstly, we can consider doing nothing, as 8 out of 100 babies which are found to be breech will turn to become head down spontaneously. For the rest, we can consider a vaginal breech birth. Typically, we recommend labouring in a consultant-led unit, and we can offer continuous monitoring of baby's heart rate during labour. It's important to note there is a 40% chance of requiring emergency cesarean sections during a vaginal breech labour. Oftentimes, your midwife or obstetrician will do very little as you give birth. We will sit back, observe, and act only if baby's tilting to one side, requiring correction, or if it's taking a while for baby to come out, risking them lacking oxygen and long-term brain damage. If you're aiming for a vaginal breech birth, it's important to note that most maternity unit will advise against induction, and we would only consider augmentation with the oxytocin hormone after very careful discussions. We would also advise against vaginal breech birth if baby's head is tilted backwards, if they're very small, or if the pregnancy is complicated by diabetes, preeclampsia, or other conditions. The second option we can consider is to turn the baby to become head down before labour. Oftentimes this is achieved via an external cephalic version, or ECV for short. This is done from 37 weeks of the pregnancy onwards, and the success rate is around 50%. There will be factors which will improve those odds. For instance, if your BMI is less than 30, if you've had previous vaginal births, or if we were to use medications to relax the womb before the procedure. We'll cover more about ECVs in the next video. A less common way of turning the baby involves moxibustion. This is a kind of traditional Chinese medicine involving the burning of mugwort leaves at specific acupuncture points. It's done around 34 weeks of the pregnancy by a trained care specialist. Lastly, you may choose to forego a vaginal birth and opt for a cesarean birth instead. We would typically schedule this at around 39 weeks of the pregnancy to limit certain risks to baby. Before your procedure, we will perform an ultrasound scan to see whether baby's breech or is head down. If baby is head down, your obstetrician will discuss with you the options of either proceeding with a cesarean section or to wait for labour to occur. I have more information about cesarean births in a different video. With the different options, we need to talk about risks, especially to baby. The term breech trial, which was published over 20 years ago, investigated the different ways we could manage a breech presentation, and they found that the risk of short-term severe harm to baby was 5 in 10,000 with a cesarean birth, 10 in 10,000 if the baby was born vaginally whilst being head down, and 20 in 10,000 if the baby was born vaginally whilst being breech. This study had a significant impact with how we practice because it was a randomized controlled trial, and that's one of the best ways to investigate how safe or effective a treatment is. However, since its publication, researchers have found flaws in this study. More recent data from non-randomized trials have shown that even though a vaginal breech birth is still riskier than a cesarean birth, the risk is not as high as previously thought, especially if the baby is not small and the pregnancy was not complicated by diabetes or other conditions, and if there was a skilled and experienced practitioner involved in labour. And there lies the problem: experience. Since the publication of the term breech trial, we as doctors are becoming less and less exposed to vaginal breech births. Therefore, it's important to note if your healthcare providers are not comfortable with a vaginal breech birth, choosing a different option may be a safer choice for you. If the breech was found during labour, we will discuss with you the options of either continuing with labour or to have a cesarean section. However, if the baby is about to come out, a cesarean section will not be safe. I hope this video helps you make an informed decision when it comes to breech presentations. Give this video a like if you found this helpful. Comment down below if you've had a vaginal breech birth, as I love to hear from you. Subscribe to the channel and share this with friends and family, and I'll see you again soon.